Hi, I'm Ed Jacobs, founder of Impact Therapy. I'm here with Heidi O'Toole, who is a visiting professor at West Virginia University, where I teach. And what we're going to talk about is how Heidi uses counseling theories and impact therapy with addictions clients. So, Heidi, why don't you first talk about addictions a little bit, just
Sure.
very quickly?
Well, addictions is a process, and we know that it is uninterrupted, it's chronic, and it's fatal. Okay, so it's progressive, chronic, and fatal. So, as is with any type of mental health issue, we want to intervene as soon as possible and to interrupt or disrupt that process. With addictions, it's life and death. And so that intensifies our just our approach and wanting to get to the issue sooner. That's why impact therapy certainly is a great fit for the addictions population because of the nature of the disease. And without intervention, as we know statistically, people die.
And it moves quicker.
Moves quicker.
Impact therapy says be multi-sensory, so you use, and it is also theory driven. What are the theories that you use with addictions, and how does the impact therapy fit in?
Well, reality therapy, or now choice theory, certainly is just a staple of addictions counseling. And because of having to take a look at the responsibility piece in your own addiction rather than blaming others, which is then a great fit with REBT, having to again assume what can you change. We can't change the people, places, and things that might have been a combination of where it is, how it is you ended up addicted. And then, of course, the ego states with transactional analysis. Nobody drinks, drugs, gambles from their adult ego state. It's always from the not okay child or critical parent of self.
Well, talk some more. That's the theories. Now, you use impact therapy by using chairs.
The whiteboard, certainly use the whiteboard, and especially when you're integrating theories into the multisensory, you want to take the concept again of the theories and what you write about in your books, and we want to make this concrete. So we go from, if I may just draw, we go, this is the approach when we think about how the brain processes information. We go from a broader goal. Okay, so this is a broad concept out here, and we want to try to focus the brain so the person can process the information and relate it to their direct life experience. So the broad piece here is the right brain, and that's how we engage, and that's where you use the multisensory to engage the brain.
I think of using
this. Is, absolutely.
Yeah, I pick up this, and I go, that's what's going on.
That's who you've become.
And that's sort of challenging their rational versus irrational.
They can see, oh my gosh, they can relate to that. And then what that does, it opens up the left brain and it connects the dots to where they can see themselves in what it is we're demonstrating.
But you're always thinking theory when you're doing this.
Absolutely.
Yeah.
I'm thinking, what ego state is my client in? And again, if they're addicted, or if they're considering, is this really affecting my life? They're in their child ego state.
Now ego states comes out of transactional analysis,
Yes.
and unfortunately, I think a lot of people aren't as familiar with that.
Mm-hmm.
But I agree with you. It just makes perfect sense.
And then we know from the process in recovery, you're moving the person from, if this is somebody that comes in and they're addicted, so if you look at this, then we want to, obviously the primary goal is to get sober, okay, and then you want to move them from that seat to what we call the thinking seat, or the adult ego state. Yeah. You see,
get this out of the way.
Get that out of the way
and
first, and then move them here. So the counseling process, you've got to use theories to move somebody from this seat to this seat.
Sign
sure.
Right
Yeah.
there.
So you definitely. I mean, there's just no way that we can.
I don't know if it'll stick there.
I don't know if it'll stick.
But that's fine.
Yeah. So.
But I wanted to show that because
sure.
I use. Don't you use a thinking?
All the time. And without theory, I'm not going to be able to move somebody from this seat to this seat. I can work really hard, I can encourage them, I can offer them hope, but theory-driven counseling really shows progression. and it makes sense. It opens up the left brain.
And in your workshops, you teach a lot of theory
Yes.
as well as the impact therapy.
It's a combination,
Yeah.
yes.
And the use of the creative props and
Yes.
all that. But what I think a lot of people think is, oh, this looks cute or props.
Oh, right, it's just a dog and pony show, and it's not about that. A lot of people, when I come into my workshops, they say, oh, we're going to play today. And it's not play therapy, but it's the use of props, the board, movement, using all of the senses in order to make these theoretical concepts more concrete.
Well, and you were talking about it, and I think we're going to do another clip on it, but just you've studied a lot of the brain. I want to call it brain psychology, but that's not the right term.
Neuropsychology, right?
Yeah.
And the impact therapy absolutely is, to me, was a precursor to now what we are showing as neuropsychology and Gestalt therapy. Again, a theorist it was the pioneer of using movement and getting both sides of the brain involved in processing not just the problem, but then the solution.
Yeah, but the emphasis that I want to make is that impact therapy is theory driven. And for more information on impact therapy, go to impacttherapy.com.